Shainfeld, and I work for the Indiana Home and Hospice Association.
Great. We have any more? All righty. So we do not have a quorum yet to approve of our minutes from May and July. So we will continue on through our agenda, but thank you for joining the choice board. We're happy to have everybody here. Nice audience that we have in our room today. To new business, just for our choice board members to keep in mind, we will be electing our chair and vice chair if we do get a quorum today. If not, we will have to move that to our next meeting. This is actually going to be my last meeting as chair of the choice board and on the choice board, as I am moving on from the ARC of Indiana. My last day with the ARC is next Friday, and I'm moving on to RJL Solutions. So I will no longer qualify to be on the choice board, but I've greatly enjoyed my time with everyone here, and I will still continue to attend choice board meetings as my schedule allows. So thank you for having me. Lori she is our current vice chair, and she said that she'd be willing to step in as the chair role if that's what you all want to vote on, but we would need a vice chair to step in whenever Lori is not available. So I don't know if Beth or Jim or anyone would be willing to step in as vice chair of the choice board. So just something to think about as we look at electing our new chair and vice chair for the choice board, which we cannot do currently because we do not have a quorum. So that might be later on today or next meeting. And then I guess we can go ahead and kick it off to Cora to come and introduce herself. So Cora is the new Medicaid director for the state, and we are super excited to have her here because we deal a lot with Medicaid in the state of Indiana. So Cora, thanks for being here.
Thanks, Hannah. Good afternoon. Thank you so much for having me today. I'm really happy to have the chance to just tell a little bit about myself and the work ahead of us in the Medicaid division. Some of you have already heard sort of my spiel, so apologies in advance for any repetitive nature. But for those of you that I haven't had a chance to meet, this is really great opportunity for me to share some of the good work ahead. So again, my name is Cora Steinmetz. I am wrapping up week 5 as director of the Office of Medicaid Policy and Planning. And it's been a really great opportunity. And I'm very thankful to hold this position. So previously, I worked in Governor Holcomb's office as the Health Policy and Operations Director for the last 2 years, which gave me the opportunity to work closely with the Department of Insurance, Department of Children's Services, Department of Health, Board of Animal Health, and of course, the Family and Social Services Administration, including the Division of Aging, as well as the Office of Medicaid Policy and Planning. So familiar a little bit at a strategic level with some of the big initiatives that we have ahead of us. Prior to my time at the state, I worked for a large hospital system here in the state in a variety of finance and government programs roles. So that's my background. And I don't have a formal agenda for this presentation. Happy to hear feedback from you all if there are specific areas in the future that you would like our Medicaid team to engage with you all. But I can just share sort of some high level areas that are top of mind for me coming into the Medicaid director role. First and foremost being that when Dr. Rosiniak first spoke with me about the position, one of the things that he specifically highlighted as an area that would be of importance coming in is really working very closely with the sister divisions, including the Division of Aging, the Division of Disability and Rehabilitative Services, and our Division of Mental Health and Addiction. So really, I'm lucky to have worked closely with Leslie in my prior role, and even in her prior role as general counsel for the agency. And then, of course, now as Division of Aging Director, Kelly Mitchell, Jay Chaudhry, myself. I'm really committed to ensuring that we're serving Hoosiers with a whole person mindset, looking at social services as a single delivery mechanism. And of course, Medicaid being a large funder of many of those social service areas, as well as a key piece of an individual's life for those who qualify as it relates to their physical and behavioral health needs. So big projects that are underway within Medicaid, some of which, maybe all of which you may be familiar with, include our Medicaid unwind activity as we complete redeterminations for the first time since the start of the pandemic. We are 5 months through the Medicaid unwind and return to normal operations. So really intentional about doing that in a transparent and efficient process so that individuals who do remain eligible for Medicaid are able to maintain their eligibility without any gap in coverage. And we're pleased with sort of the direction that that's been heading. We have a lot of information out on our website if that is an area of interest for you, including some really nice dashboards that we've worked with our data teams to provide, and they are interactive, which is really nice. You can drill down to the county level and sort by a number of other demographic areas. Additionally, our strategic rate matrix work is well underway. So we were pleased to collaborate with our legislative partners on that and have our rate matrix, which is really just a fancy word for a schedule of rate updates, codified into the budget bill last session. And so our first round of rate work for 2023 is nearing completion as we bring a few service category areas to the state budget committee next month. And then in addition to our behavioral health work, the Medicaid team is working really closely with DMHA, as I mentioned, as we look to transition one of the models of care to the certified community behavioral health clinic model, and look at how Medicaid can be a funder of mobile crisis services. And then finally, as you may be familiar with, our Indiana Pathways for Aging program, as we move closer to the launch of that program next summer. Leslie, Kelly, Mitchell, and I have been working very closely on that as we move into a managed long-term services and support program, as well as sort of LTSS reform and waiver transition activity. So those are really the big topics. I know I went quickly through a lot of material. So if you have questions, I'm happy to take those, or if you see areas in which Medicaid can be more integrated with the choice board, we'd love to have those conversations. But otherwise, feel free to reach out to me after this if you would like to set up some time to discuss.
Thank you. I have some questions pertaining to Medicaid and dementia care.
Okay.
I've had quite a few people in my district to ask questions about what programs are there for individuals who could be suffering from dementia, and maybe in the early stages as well as those in the later stages of it, because a lot of the nursing homes and facilities like that don't necessarily offer all the care that is needed for those individuals. So what you have is a lot of people with dementia who could be receiving services who are just sitting there. And I understand that Indiana is a CMI state. So with that being in mind, I know that Medicaid will pay for the necessary help and treatment that those individuals need. So where are we on that?
Thanks, Representative. It's a great question. There is with Pathways and with some of the work that Leslie's team is doing, there is a lot going on in the dementia space. I would love to provide you some more information on that. Leslie, I don't know if you have anything, and I know that there are a number of folks in your space who have been working specifically on this topic.
Yes, and actually we'll be getting an update later from Shannon Effler, who is spearheading our statewide dementia strategic plan work. So that may answer a lot of your questions. But we are, yes, it is a space that we're working to really focus on, understanding there are lots of folks that need services and supports, and there's lots of unmet need that we need to be thinking about and planning for. So I think maybe hold tight and highlight those questions after Shannon shares her information, if that's okay.
It's a fantastic question, and I apologize. I do have to duck out a little bit early. So if I'm not here for that part, Leslie will be sure to follow up with me if there are Medicaid specific pieces of that we can help address. Thank you.
I'll go. and maybe Leslie will chime in, but I've been asking the same questions for a year or two about the way that MLTSS is going to work with the AAAs and with the choice program. And I don't think we've still received complete answers to those questions. We've gotten some bits and pieces. So thank you, Leslie, but any updates on any of those issues? I can go through them if you'd like, but I think you've heard them enough.
Yes, and certainly remind me if there are ones that I don't address. So we did share, I think yesterday, we put together, we've been since the last meeting working on the list of services that are on choice but not on waiver today and what that looks like. So we did do an analysis of those services, looked at waiver authority, looked at our Medicaid state plan authority, and shared a chart with the choice board that really breaks down by service what is on choice today, what is an analogous service that might be on the waiver or on the state plan today, if that exists, and then just some information on background on that. So you all should have that in your inbox to review further, and then we are happy to continue that discussion. By and large, a lot of those services that I think we highlighted as not potentially on waiver that are on choice, there is some components of those services that are usually on waiver or state plan. There's a couple of exceptions there. And some of them, it might be a different service delivery model. So the Capable program is one example. Capable is a service available under choice that's essentially a bundled service to kind of take a holistic look at folks in their residence and what services and supports they might need to meet their goals. The services you can get under Capable are all available under the waiver, but CMS actually rejected our attempt to put Capable model specifically in the waiver. So you can access the services, it's just not bundled together. So that's one example where it's set up a little differently on choice, but you can still access it under waiver. So that was one of the main takeaways from the last meeting. I know you had asked about specifically on the different services and why maybe choice and the waiver don't align exactly today.
Why did CMS reject the Capable piece?
They did not approve the bundled payment model. That is kind of the core structure of the Capable model. They said you can't bundle those services together that way under the A&D waiver.
Well, and I'm looking for the email. Was that from Julie?
It would have been from Aaron Wright.
From Aaron? Okay, let's see if I have that. But then going back to a couple of the high level issues without getting too granular, the minimum of 50% of the case management, or I think we're calling it care coordination, right, at the AAA level.
Yes.
So still seems like case management to me, but we can call it care coordination. But the minimum of 50%. How are those cases going to be assigned in a fair way?
Mm-hmm.
And have we made any more progress on what the reimbursement is going to look like?
Yes, so it's called service coordination under pathways under MLTSS. The AAAs a few months ago decided to work together under what's called a community care hub model that is being spearheaded by SACOA and Aging and In-Home Services, but all 15 AAAs have signed on and signed letters of intent to work together and contract with the MCEs under the community care hub. Since mid-August, we have been having meetings, FSSA has been having meetings with the 4 health plans and the community care hub leadership to help facilitate those contract discussions and discussions regarding how service coordination will work, what the process will look like, what staffing will look like, the decision points that will lead to figuring out what that reimbursement structure will look like as well. So those conversations are ongoing, and we plan to have meetings through the end of October as a collaborative group to hopefully at that point have the health plans and the AAAs set up and on the path to finalizing their contractual relationship together. So we've been kind of knocking down different topics as they've been raised up by the health plans and by the community care hub leadership to work through those questions. It might be helpful in the November meeting to have, if they're willing, to have the community care hub folks come and talk a little bit about what their structure looks like and what some of that will be, just to provide that additional information as well.
Okay, can we plan on that?
Sure.
Let's do it. I'm looking at the list. I see Aaron's email from yesterday. So there's 17 services.
Yeah, that sounds right.
So. Like, I mean, the first one on the list is congregate meals. So it says, that's a choice service, obviously, and then same or similar A&D waiver service or state plan, none. And you've got a bunch of notes on here, but can you use congregate meals as an example?
Yes, Aaron, would you want to come up and talk about that one briefly? And while Aaron's coming up, I see Tarek is on the screen and I kind of volunteered you, but I just want to, do you have anything to add on the community care hub discussion or anything like that?
Not at this time, Leslie. I was kind of nodding my head to Representative Clear's suggestion of having the CCHI leadership team come in November. We'd be more than happy to do that.
Okay.
Thank you.
And we'd like to have them at the Commission on Aging meeting too, if possible. Thank you.
So congregate meals on choice mirror the requirements of the Older Americans Act service. So a congregate meal is a meal served typically in a senior center or senior housing that people come to have a socialization component, a nutrition education component. It's not a service planned service like attendant care or home modifications. It's really a community driven service, whereas the waiver are all service planned services that require a service plan. And there are I think it's called the federal financial participation rules related to the services that are provided.
Yeah, well, I know what a congregate meal is. That wasn't what I was asking. What I'm asking is, it's a choice service, but not a waiver service. I mean, there's no such thing. I mean, it's provided in a congregate setting, but there's no such thing as a group choice service. I mean, in order to participate in that in the group setting, an individual would have to qualify for choice.
Yes, so I think actually there's only one AAA that is using any choice funding for congregate meals.
Which one?
And I don't have it with me right now.
Okay.
I can look it up when I sit down. And I looked yesterday though, it's 0.01% of the choice funds are spent on congregate meals. So it's very small. It's just a couple $1,000s. So I think the AAA that is using it is putting those dollars to somebody that's enrolled in the choice program or multiple people.
Well, I need to spend more time with this, but what concerns do you have now that you've provided this analysis of these 17 services?
So I think part of what we see with this is making sure we're being proactive in education for the AAAs and the health plans and any other folks in this space, making connections for services that for folks transitioning from choice to the waiver or to pathways, understanding the services you're on today with choice, here's how you can access them once you transition over, and then continuing to have the discussions as well on those services where maybe they're not aligned with choice and they could be, and having those discussions with the pathways team and with the health and wellness team on potentially adding those to the waiver in the future state or changing the structure under the waiver if permissible. So those were at least the next steps that we had kind of identified when we looked at it.
Well, one that jumps out at me is outreach. It says in the notes, there is no waiver service to identify potential waiver participants. So does that mean that the contracts with the managed care entities don't require them to do anything in the way of outreach?
No, what that means is there's no waiver service that you can bill a waiver claim for in the same way that you could for choice. That's how I would, is that accurate?
Yes.
Yeah. So I mean, there's lots of other outreach functions that occur. It's just not a claimed billable waiver service today.
Okay, well, thanks for providing the list. I'll look at it some more and may have additional questions, but appreciate the list.
Anybody else have questions for Cora? Okay,
Thank you very much for your time.
thank you so much for being here. Senator Charbonneau, not to put you on the spot, but could you introduce yourself to everyone?
Sure. Ed Charbonneau, State Senator, 5th District. I represent most of Porter County, all of Pulaski County, all of White County, and a portion of Jasper County. And I chair the Health Committee in the Senate.
Thank you. And then Jim, could you introduce yourself, please?
Jim White. Sorry, I'm having trouble walking these days. And it takes a long time for me to get from the damn garage. There's no parking nearby, so. Sorry I'm late today.
No, thank you for being here. Up next is general updates from the Division of Aging. Oh, Megan, would you introduce yourself? Yes. Megan, are you available to introduce yourself?
Yes, hi, sorry, I was trying to unmute. My name is Megan Smith, and I am with Golden Gardens Adult Day Center. So we services Medicaid and choice clients.
And then Representative Clear.
Hi, Ed Clear, State Representative, House District 72, which is in Floyd County.
Great. And quorum. Okay, while we have quorum, everyone, could we jump back and could we approve the May and July 2023 minutes? Does anybody have any questions on those? Comments?
Move for approval.
Okay.
Second.
All right. We have a motion to approve the minutes for May and July. Do we have everybody say aye if they agree?
Aye.
Any nays? Okay, we have approved finally our May and July minutes. Thank you, everyone. Just some new business. So for those of you that weren't here at the beginning, we have up for election our chair and vice chair. So currently I am chair of the choice board. This is actually my last meeting on the choice board as I am leaving the Arc of Indiana next Friday and am moving on elsewhere, which makes me ineligible to be on the choice board. Lori is currently our vice chair, and she said that she would step into the role as chair if you guys would like her to. But then that leaves the vice chair role open. So first off, I guess we could say, does anybody want to be chair? If not, we can vote Lori in.
Lori's on a wonderful vacation out west right now.
She is.
All those monuments and beautiful scenery.
So does anybody have any? Do they want to be chair, or are you okay with Lori?
Does Lori want to be chair?
Lori has said that she would step in as chair.
Lori's a great choice.
Okay, so do we have a motion to approve Lori as chair?
So
Do we have a second?
Second.
Okay, so all in favor of Lori becoming the next choice chair?
Aye.
Okay, any opposed? All righty, does anybody have any desire to be vice chair to step in whenever Lori is not here?
Well, I think I got a cat that's big enough for it. On the commission on aging.
well, it looks like I'm the only one here, so I'll volunteer.
Thank
And the
you.
chair.
Excellent.
Thank you, Jim.
Sounds like chair before and in the future chair again. You're back in the line of succession.
Anybody else want to be it? If not, I move to have Jim be our vice chair.
Second.
Okay, all those in favor of Jim being vice chair, say aye.
Aye.
Any opposed? Okay, so Jim, would you like to take over the rest of the agenda?
That was sweet.
Not really.
Quickly times change.
Well, I can do that. I guess, general division of aging update.
Yes, so we covered a little bit of it with the list of the choice versus waiver services. The other item I had for an update, you all should have a nice one pager in front of you. These are kind of hot off the presses with the pathways for aging. Yes, ma'am. Did you not get one?
I did.
You did.
Have a little question here. I think this should be late winter. Is that 23?
Nope, that should be 23. You were right. Well, or yeah, late winter 23. Or early, yeah. So we will. We'll take that back. Yeah. Make sure that gets updated. So like I said, very hot off the presses. So thank you for catching that. So
Say something. Quite read right.
no, that's a good catch. So this is just an example of kind of the first documentation that will start coming out for consumers to start providing education and outreach for pathways. So things you'll see are, you know, kind of some of the language we're using, the pathways logo, things like that, the high level kind of time frame on there where you can sign up for updates. So really just sort of like the first really high level pass of some of the consumer outreach that will be starting here soon under the great work that the consumer outreach team and the marketing team and communications team has been doing. So wanted to share that with you all. I know the communications topic has come up a couple times with the choice board. So I wanted to make sure you guys had a copy of that. We'll certainly continue to share out information as that becomes available. And if you do spot things that you have questions on, or feel like there's something missing from any of these, I mean, certainly always welcome to feedback. We want to make sure we're getting the message out there in the right way and to as many people as possible. So just wanted to share that for awareness for folks that you'll start seeing more of this. You'll start seeing, you know, different advertising and campaigns and information out there as we start really ramping up, spreading the word leading up to go live in July 2024.
Thank you. And this does really spell out who it's for, which should have been a concern also. Thank you.
Yeah.
Clarity there.
Otherwise, general updates. I didn't have anything specific on my agenda to provide updates on. I know we got a question at the Commission on Aging on expedited waiver eligibility and status of that. So I'll share a similar update here. We did, as I mentioned at the last meeting, we got CMS approval to include expedited waiver eligibility in our permanent aged and disabled waiver back in late June. And so we are working on the process and what all of that will look like to expand that statewide and make that permanent. We have a couple of technical items that CMS flagged in their approval that we need to work through before we can get that rolled out statewide and on a permanent basis. So we're working through that internally. We're also working on some updated training that we'll share with the existing AAAs performing those services, as well as the other AAAs. This will be expanded to under the permanent function. The AAAs will be the ones performing the expedited waiver eligibility services as they do the waiver eligibility function today. So we're working on that updated training so we can share that out and just do a refresher for those AAAs who have been part of the pilot all along, as well as the handful of AAAs that will be new to this space. The ones doing the pilot today really cover all of our most populated areas. So we don't expect to see a huge increase population wise on EWE because the newer AAAs and the newer areas of the state are kind of our more rural areas. But certainly it's very important to make sure we've got consistent training out there and everybody has a consistent experience on going through the EWE assessment. So that's what we're working towards. Hope to have that rolled out here soon in preparation of transitioning to that permanent process. Our goal is to get there by November because that's when that permanent pilot authority ends and the permanent waiver authority would pick up. But like I said, we're still working through some of those questions with CMS as well. Any questions on that or any other aging items that anybody wanted updates on? The last thing I'll mention, actually choice specific, is so we do have that choice assessment that we're working on for the 0 to 1 ADLs. And so we hope, I think by the November meeting, we'll have some updates on that end too. So it's moving along and progressing nicely. So we should have some good information in November for that.
Okay, is that it?
Yes.
Thanks so much. Second to last item, Shannon Effler is here to speak about the Indiana's dementia strategic plan.
Yes, thank you. Hello, everybody. Good afternoon. I am joined today by the steering committee of the dementia strategic plan. So want to ask them to turn their cameras on if they're able so that you can see their beautiful faces. And I hope that you walk away from the presentation today really with the understanding that this has really been a highly involved stakeholder engagement process. And really, I'm here talking to you about it, but they are the ones who really been leading it. So thank you for having me. Okay, next slide. So many of you know me, mainly because of my former roles with Indiana Medicaid. I was the Director of Care Programs and then the Director of Indiana Pathways for Aging and Hoosier Care Connect. In my new role, I am the Director of Geriatric Programs with IU Geriatrics. And part of my scope of work is to coordinate Indiana's dementia strategic plan. So again, that really means coordinating all of the leaders and the stakeholders, getting their input so that we can deliver our report at the end of the year, which I will talk a little bit about. But I started in this role as the Dementia Strategic Plan Coordinator not that long ago, in early August 2023. And my background is I'm a social worker and I have 15 plus years of aging and end of life professional experience. Next slide. Okay, so to remind you all, what is the goal of the Dementia Strategic Plan? It is to identify and significantly reduce the prevalence of dementia in Indiana. FSSA started this work in 2019 when they launched the Dementia Care Initiative. In 2021, that's when it was put into legislation, and it is a requirement, responsibility of the Division of Aging to coordinate the Dementia Strategic Plan. Since then, it's been codified into Indiana code. Next slide. So how are we structured? Obviously, the Division of Aging, FSSA, leads this work. Amy Rapp and I, who's here, partner on it. And then I've been contracted to help with the coordination. We have a steering committee that I spoke about. And then most of the people who are on the steering committee lead a work group. And we have 4 work groups currently. We do expect them to evolve as time goes on, and we're looking towards 2024. But those work groups are directly tied to our objectives that is in legislation. And those are HCBS access, workforce, public awareness, and quality of care. And then we have an advisory board. So the first time the advisory board met was in 2022 in October. And that advisory board is quite large. You'll see all of the entities, the organizations that participate in that. And that's one ask I have of you today, is to help give input on who are we missing, who else should be at the table. And we are gearing up for our second advisory board meeting in November. So next slide. So I want to thank all of the steering committee members who are here today, and you can see them listed there. They volunteer their time. I want to underscore that because they are so passionate and definitely identify that this is a huge need and challenge in Indiana, and we need all hands on deck to make progress in this area. Next slide. Okay, so what's our current status? I mentioned our ultimate deliverable outside of all of the amazing impact that we're going to be doing is we are required to submit a report to legislators at the end of the year. So that's due December 1st. And it goes through a multiple layers of review through FSSA leadership. So what the steering committee is doing is they are gathering recommendations that are tied to each of those objectives. And then Amy and I will draft the report. It goes to Andrew and Leslie, then it goes to Gus, who's also here, and then ultimately it will go to legislators. I would love, that's an opportunity for you guys. We have some of you here to provide input, dialogue, ask questions. And I really encourage you to look at it. We're also really open to ideas about how to just share the recommendations on a more wide basis so that we can get more momentum going when it comes to the dementia strategic plan. And then we will have our annual meeting, as I mentioned, in November. What we are preliminary thinking for 2024 is having a kickoff in January or February, where we bring the whole advisory board back together, hopefully in person, and really do a deep dive into, okay, we have the recommendations now, how do we get it done, right? That's the hardest part to figure out, is how do we get this done? And what are the steps that we need? So that's what we are hoping to do in early 2024. Next slide. Okay, so I have asked each of the steering committee members who serve as a work group lead to talk to you a little bit about their experience thus far, the process of this DSP work, as we call it. So I asked them each to identify a peach, a pit, and what they're looking forward to. And if you're unfamiliar with what is a peach, what is a pit, mainly means the peach is something that you're feeling really positive about. A pit is something that might be a challenge that's currently going on. So with that, I will turn it over to Dr. Ellman. Are you on? Okay, maybe not. I can read hers for her. So she's leading our workforce work group. The charge of that work group is to identify strategies to enhance Indiana's dementia-based workforce. So let's see if this is testing my eyesight. So the peach is working with a steering committee and task force devoted to improving the lives of people living with dementia and their caregivers in Indiana. Thank you, Erin. And then the pit, we very well know the many nationwide workforce challenges that are going on and combating that right now. What she and her work group are looking forward to is continuing the innovation in Indiana and the next steps related to the Indiana DSP. Next slide. I will turn it over to Matt.
And thank you. My name is Dr. Matt Nesbitt, and I'm here speaking on behalf of Dr. Kathleen Unruh. And I'm at IU School of Medicine as well. I'm going to start with the pit, actually. So as you can see here, the pit here is that this past year, one thing we've been challenged to do, the pit we found, is to first understand how our work group aligns with all the other work groups, so we can complement and not either ignore or overlap with others' tasks on the other work groups. But a peach pit isn't something to bemoan or avoid, even if it's not a good idea to eat this peach pit. If you plant it, as I'll do, you can oftentimes get a peach, and that's exactly what we've done. The peach that we've found is that we've enjoyed learning from others on the steering committee. We've been inspired by what others are doing, especially their work on seeing the progress they've made and their insights and approaches. And we're learning from their insights and approaches, particularly their processes about what we're really setting out to do. And that leads me to one thing we're looking forward to, which is to making a plan to obtain actionable insights from the novel data sources and potential pathways that are and potential analyses that are tied to the pathways data. We've organized our work group around the contention that these new data sources and new models can elucidate needs and how persons with ADRD and their caregivers can best be supported.
Thank you, Matt. All right, I'm going to turn it over to Dr. Council, and I think here, Representative Jackson, he may be able to address some of your question. Thank you. Steve?
Yes, good afternoon, Choice Board. Thanks for having us. And I'm reporting on the Home and Community-Based Services, or HCBS Access Work Group under the Dementia Strategic Plan Initiative. This is really looking at access to dementia-specific or dementia-capable services. And what our group has recognized is that we have a lot of services and supports for people living with dementia, but most of them are not specific to dementia per se. And we also have a gap in services in that there's not a lot of attention or specific services to support caregivers. And so it's been a tremendously invigorating process, and we've got as others have said, passionate people about this. And so, and a lot of activities going on in this area over the past year and coming forward. So I've got a couple peaches here. One is we've just finished a project that I've presented to the Choice Board in the past, the Administration for Community Living Dementia Care Grant under IU, and working with 5 area agencies on aging that employ a dementia care coach that have been working with older adults with dementia who are Asian Disabled Waiver participants and their caregivers. And specifically, that project just ended in July, and the 5 AAAs between them saw over 500 caregivers and helped support and train them in improved interaction, communication, and support to their loved ones with dementia. We have recently gotten some of the final data, which confirms that we've not only decreased behaviors, dementia symptoms in those older adults with dementia, but we've decreased substantially the caregiver stress experienced by their caregivers. The second project that I wanted to share that I think you're also somewhat familiar with is the state's work with the Medicare plans for dual eligibles and the collaborations over the last 2 years, really, with the area agencies on aging. And we've developed specifically proactive referrals from those health plans of their members with dementia. And so when they identify a member with dementia, they make a proactive referral to the area agency on aging of that member and their caregiver to help them become more aware and better access services that might be helpful to them in remaining in the community. And this not only is Medicaid services, but it's choice services that some of them may be eligible for, Older Americans Act services, and other local community-based supports. So a lot going on here to advance access to home and community services, and lots to come. And so with the success of that Administration for Community Living Caregiver Support Grant, the state and the Division of Aging in particular has funded us over the next 18 months to not only continue with the 5 area agencies on aging, but expand to include 5 additional planning and service areas. And so we will have 10 out of the 16 planning and service areas covered, each having at least 1 dementia care coach serving older adults with dementia and particularly supporting their caregivers. The second initiative that they're really looking forward to is the Pathways program. There are specifically delineated dementia care programs to better meet the needs of people with dementia and help them access services and supports that will help them remain in the community and support caregivers. And then finally, as you're aware of the legislation recently enacted, where each of the area agencies on aging across the state will have a funded full-time dementia care specialist. And this is a very different role from the caregiver support program that we've been developing. This is specifically to have a dementia care specialist at each AAA to provide public awareness and about the services available. So it should really help people access services. And 2, to train area agency on aging staff and others to be more dementia knowledgeable and friendly and capable, so that our services, the many services we do provide, might be more specifically able to address the special and unique needs of people with dementia and their caregivers. And then finally, the dementia care specialist will be responsible for interfacing with healthcare professionals, healthcare plans, healthcare systems, And so that we'll get better coordination and integration between the healthcare side, which we know is challenging for people with dementia and their caregivers, and connecting that with the social services and such. So a lot of exciting things going on in this area in particular, and thanks for the chance to tell you about it.
Thanks, Dr. Council. All right, next slide. Natalie.
Hello, everyone. My name is Natalie Sutton. I'm the Executive Director of the Alzheimer's Association Greater Indiana Chapter. I just want to start with the legislators on the Choice Board, thanking you for passing this Dementia Strategic Plan legislation a couple of years ago and getting this process underway, because I think it will make a big impact on our constituents. And then I also want to thank the Division of Aging for investing in Shannon's role, because Shannon and her predecessor, Don, have really helped to formalize this work and move it forward with a lot of momentum. So we're really excited about what we've done this year. So my Peach, I lead the public awareness work group, and we are charged not only with growing awareness among the public for early detection and diagnosis of Alzheimer's or dementia, as well as brain health, but we're also charged with educating healthcare providers. And the Peach for the year for me was really that in this work group and the steering committee, as others have mentioned, we had incredible participation, very robust discussion, and we have a large group of people who are very passionate about Alzheimer's and dementia and some of the service gaps and some of the opportunities in front of us. So that participation was really my Peach. The pit is that in really looking at the objectives of our work group and the participation in our work group, this was a voluntary process, and most of the people who selected the public awareness work group are similar to myself in nonprofit social services organizations, and we lacked any representation from healthcare providers, primary care, and any participation from the Department of Health or of other public health specific expertise. So I really think moving forward, we could benefit from people who have experience with other disease states that focus on early detection and diagnosis, specifically for this work group and its objectives. And so one of the things I'm most looking forward to is publishing the recommendations, because I do believe that when we publish and share our work, it provides some accountability. So we will all then become focused on getting the right partners around the table and moving into execution in early 2024.
Thank you. All right, next slide. So you've heard from our work group leads, and now what about next steps? So Dr. Council talked a bit about the Dementia Care Specialist Program, which is funding a position in each of the AAAs devoted to what I fondly it's in development, but a more macro leveled, getting education, training, connecting with healthcare providers, position, right? So that is separate. It's very connected to this work, but it is separate, and the DA is working to secure a position and hire a full-time person who will be leading that. And I will be working with that individual very closely. Phase 2, so phase 1 was really this past year, and that was about identifying recommendations tied to each of the objectives. And then what we're calling phase 2 in 2024 will kick off, and that's about how do we get it done? And what do we need to do? So that is, we're hoping to convene everyone in early 2024 and talk about that together. I'm hoping that you'll have me back to this meeting in early 2024, where I can go over the recommendations and the report from 2023, and we can digest that together. And then my ask of you today is I welcome any input on additional organizations that you think should participate in our larger advisory board. So if we could go to the next slide, which Rebecca was very skilled at zooming in on this to make it a bit bigger. So we're very blessed to have a lot of different entities serving with us, but the question is, who are we missing? And Natalie mentioned that we do need to focus on incorporating more healthcare providers into the advisory board. Additionally, something that came up from the Commission on Aging meeting earlier was a focus on behavioral health and seeing how we might plug in mental health providers or even outreach to DMHA. They do have a position that is focused on serving older adults as it relates to mental health. So I thought that was a great suggestion.
I also think a disability advocate, we're seeing more dual diagnosis, specifically around Down syndrome and dementia.
Yes. And Kathy Frank, who's online today, they've been doing some of that work. And actually Amy and I had lunch together and we were chatting about that. So we're all in line with that. I think that's great. If you have a specific suggestion, Hannah, let me know of somebody.
I'm always willing to throw the Arc of Indiana on anything.
In your last days. You're welcome.
Exactly, I'll volunteer
Yeah.
them.
I think the ARC should be on there.
Awesome.
Who is representing the choice board?
I can pull that up on my computer. Do you know?
Well, it says the choice board is represented.
Yeah, let me go in and look. And I can pull it up. We have a spreadsheet and.
Well, I think somebody from the choice board should be there.
Yeah.
And I think it should be one of these two.
Yeah, well, yes, she is part of it.
Well, Jim.
I thought it was Jim, but I didn't want to call him out if he doesn't. He's not calling himself out. I wasn't going to call him out.
Whatever you'd like me to do.
Okay, great.
I think you'd
I've
have,
gotten volunteered for a lot. today.
Maybe you got him.
well, one of the great things about Jim is he is able to look at things from so many different perspectives because of his experience, as chair of this, but also, in his representation at the State House and, having addressed these issues from a variety of perspectives. So all kidding aside, I think Jim's participation would be very valuable.
Awesome.
Along with the Arc of Indiana.
Well, thank you, Jim, if you're willing. Thank you.
Happy to.
What about the Nurses Association?
I'm sorry, I was just gonna say, but you got to get Jim a better parking place.
I know, I had the same struggle today, Jim, so I hear you. It was hard.
But we have to do these.
Yeah.
Right now, I'm working on getting some solutions to my back and hip issues, but I'm just kind of shuffling right now. And that parking garage is pretty far away when you have to.
Oh, yeah.
I don't know why the entrance is on this side of there, but this side in front.
Hannah, were you about to mention nurses?
Yeah, the Nursing Association, maybe.
Yeah,
State.
I was going to suggest that too. I think we need to do some-
ISNA
Great.
and possibly one of the associations, one or more of the associations representing advanced practice nursing.
Yeah.
I have to agree. I'm looking here and what I don't see, maybe, and I'm looking too hard and I'm overlooking, is
I'm sorry, I didn't hear that.
whoever will be over nursing home.
Oh, IHCA and leading age.
Okay.
Mhm.
Okay, perfect.
Do you have like minority health?
That would go next.
I was gonna bring that up, but I'm on the board. Yes, full disclosure, I'm a board member of IMHC, but I don't see anything, addressing concerns about disproportionality
Yes.
or health equity. I mean,
Yes.
many of these organizations are concerned with increasing health equity and reducing disproportionality, but not in the same way that IMHC looks at that as a core part of its its mission.
I
So
agree. Anyone else missing? Well, I welcome further dialogue. If you want to talk about it, please reach out to me. My email is seffler@iu.edu. I think 2024 is going to be a very exciting year. I mean, we have a lot of different initiatives going on, impacting dementia care in a really positive way. So really, I'm honored to be part of it, and thanks for having me.
Thank you. Thank you so much.
Well, that will be fun to follow and happy to participate. So thank you. Kristen, you're up and I think you have some time today.
Hi, everybody. It's good to see you, especially since there's a quorum. It's so rare that there is. So I appreciate everybody being able to make it today, and do want to congratulate Hannah on her new role. And I'm just glad we'll get to work with her in her new role. So she'll be learning more about the AAAs than she probably ever wanted to know. But so she'll still be around advocating on these home and community-based services issues. Okay. So there was a really big packet today, and some people may not have received it directly because your IT system may have blocked it because it was over 10 megabytes. So I sent Julie a link to Dropbox. So if you did not receive the packet and would like it, there is a Dropbox link where you can access the packet. And there are two reasons. Oh, yes.
Suggestion, because these packets seem to be getting bigger and bigger.
I know.
Why not just send us an email with a list of links and maybe a 1 or 2 sentence summary of each article as to why we might want to click on it and read it.
Okay, we can let me think about that.
Okay.
Yeah.
Because that would also be easier to forward to other people if we had a link. I mean, sometimes you have
Right.
something in the packet that I want to share with somebody else, and the only way I can share it is either to go out and find the article myself, and then send the link, unless I want to send a 10 or 12 or 15 megabyte attachment to somebody, or I have to put your attachment into Adobe Acrobat and delete all the other pages. And it just, I think links would be.
Yeah, that, you know, the brilliance of new ideas, I'm telling you. We will, let me think about that and see if we can't make that happen for is it November meeting? Yeah. Okay. And the reason why I really tried, but it's really hard because they're like September is the month everything gets recognized. So there's a lot going on in September, which I've included in case you want to amplify things for your own constituencies, as well as in federal government land. Boy, because we're coming to the end of a presidential term, the executive agencies are all trying to get their stuff done before there is a potential change in administration. And so we're seeing over the summer a boatload of proposed rules and initiatives coming directly out of the White House. And there have been a bunch of stuff that affects our world. And so I just want to highlight those for you. And there's also a lot in here about housing. And there was also research recently released about the status of people in the younger baby boom generation and the beginning of Gen X, that because they lack standard pensions, because the world changed and nobody has pensions anymore, and a lot of people didn't have access to savings programs like 401ks that really aren't going to be able to retire. And so we need to be thinking about what that looks like moving forward for those folks. So there's articles in there about that too. But I want to start off by saying this is the time of year we always talk about flu shots. But this year there's 3 immunizations we need to consider: flu, COVID, and RSV for those who may qualify. I just got my COVID and flu shot on Tuesday. And other than a couple little sore spots on my arms, it hasn't been too bad. Sometimes immunizations can really do a number on you, and these seemed okay. So there's my pitch.
So another recognition happening this month is it's National Senior Center Month. And we certainly, AAAs house their own senior centers as well as fund standalone senior centers in their communities. And so we want to recognize the great work that senior centers do. A lot of them are congregate meal sites. And they focus a lot on older adult socialization, evidence-based healthy aging programs, et cetera. And embedded within Senior Center Month is we have a Fall Prevention Week that is highlighted in your packet. So again, that information can be delved into at the NCOA website. There was also a report recently released from Morbidity and Mortality Weekly that analyzed non-fatal and fatal falls among older adults aged 65 years and older from 2020 and 2021. This report included state tables, so you could see where your state ranked. I did not include the tables because the packet was getting so big. So to Ed's point, you can find the link, and if you want to delve into that or forward that, yes.
Can you repeat that again?
Non-fatal and fatal falls among older adults aged 65 years and older. And the publisher was Morbidity and Mortality Weekly.
Thank you.
Mm-hmm. My recollection was that Indiana on one of the measures was, if you think of 50% as the mid-range, the average, one we were below average on somewhat, one we were above average on another to the good, but we weren't like either dragging the bottom or at the top of the rankings either ways, but there were a couple different rates that demonstrated where Indiana fell. Another recognition taking place this month is Emergency Preparedness Month. And this year, FEMA has selected the theme of older adults and older adult preparedness. As part of this recognition, the Indiana Department of Homeland Security reached out to me because they publish a magazine called The Hoosier Responder. Who knew? That was new to me. It apparently has a circulation of about 50,000 people, including professionals in emergency preparedness and first response, in healthcare and government administration, as well as just interested citizens. Anybody can sign up for it. And they wanted to highlight older adult preparedness in their Hoosier Responder newsletter. And because I'm not an expert in preparedness, I did my own research before participating in the interview. And it was very interesting to think about that kind of older adult preparedness from three different perspectives or three different levels. One is the individual preparedness of older adults. And so that might get us thinking from a state perspective and working with these home and community-based service programs is how do we build in emergency preparedness and work around that into care planning for as we're going into people's homes and identifying, oh, this person may have some risks in the event of a flood or a tornado or all the other community threatening things that come our way, heat, for example, extreme heat. So that's one thing to think about from that perspective. There was also a discussion around community preparedness and how are older adults and people with disabilities considered when communities as a whole prepare to address emergencies. We did a little bit of a quick quiz at our last I4A board meeting and saw that AAAs themselves play a variety of roles in community preparedness. Some identified they have very specific roles in their community that are pre-identified. Some indicated that they're in regular contact with their emergency responders and preparedness professionals in their communities. Some even indicated they participate in exercises, practice, that kind of thing. And so we want to continue to encourage that. We may see some additional things come out of ACL and FEMA directives that might hit the state at some point. We know, talking with some of my colleagues on the West Coast, the ACL and FEMA regional administrators were actually kind of running their own little discussion initiative and involving the AAAs and other agencies. So that might be something we hear more about from a community and statewide preparedness perspective. The final element has to do with business continuity and the ability of a community-based service provider to continue their operations when they themselves are impacted by an event. But it also includes any kind of proactive outreach a service organization may make when these kinds of emergencies threaten. So for example, what kind of procedures or standard practices does the agency administer when there's going to be a high heat warning all week? Are people reaching out to some of their consumers who they think might need cooling station, might need a fan, air conditioner, et cetera? So those are some additional things to think about in terms of those business continuity and community service organization operations. So it's definitely something we should continue to talk about. It might even be required element of the state plan. I can't recall if it's a proposed element, what's in there versus what is proposed in the Older Americans Act regulations around emergency planning. So it'll definitely be a discussion that continues because we're going to be experiencing more of these extreme events because of climate change. And there are also given the extreme heat we experienced earlier this year, and quite honestly, just a few weeks ago, but also kind of that whole air quality thing with the Canadian fires and it's just crazy what's going to be impacting us. And so there were some national articles addressing older adult vulnerability and people with disability vulnerability, which is even greater than the general population. So those are things we need to continue to pay attention to as a state and as service systems. Finally, the other recognition that's happening this month is that Governor Holcomb proclaimed this week that we're in Malnutrition Awareness Week, and the Division of Aging shared some aging aligned resources and tips related to nutrition risk in older adults as part of that recognition. So that's, I just saw another big recognition that was kind of relevant, but like I said, September and August, apparently we recognize all these kinds of issues. So moving forward, we're kind of getting into the federal land part of the packet. There's an article in there from Kaiser Family Foundation that kind of breaks down some of the issues revolving around the new Medicare drug pricing negotiation schema and the drugs that they're going to be hoping to reduce prices on. CMS also released new guidelines at the beginning of September related to minimum nursing facility staffing and what they're terming Medicaid institutional payment transparency reporting, otherwise known as intergovernmental transfers or UPL in Indiana. And so these will be things that are really stirring up the waters in with our friends in the facility space. So we can continue to think about how that might look and what that's going to require on workforce on their behalf and how that's going to impact the general workforce crisis overall. So there's kind of an explanation in there from CMS as well as a couple articles from Kaiser Family Foundation about helping us to understand that impact. Another Biden-Harris administration announced a Medicare dementia care model. So that might be something that our dementia advisory board looks into as part of their strategic planning. And the White House also announced new actions to what they call lower healthcare costs and protect consumers from scammy insurance. And so I believe parts of these affect Medicare Advantage advertising regulations. So that will be something that moving forward that we might be paying attention to, addressing surprise medical billing, protecting consumers from medical debt, unfair medical debt, and things like that. Earlier this summer, we talked about how the Administration for Community Living released proposed regulations on the Older Americans Act, which I don't think that's another one of those that hadn't been updated since, like 30 years. And so there was a lot of work in responding to that. I've included our National Association's comment letter. It does address some of the key considerations that we had in our state, but it also addresses, of course, issues from AAAs in other states, because we know that states operate their AAA networks differently. So there might be some things you're kind of like, what? I don't know where that's coming from. And it might be addressing something in another state. Another proposed rule that came out is the calendar year 2024 physician fee schedule in Medicare. And this was important for us as the Home and Community-Based Service Network because it included some additional potential new opportunities to pay out of Medicare for social care management. So right now, there is an ability for community-based service organizations to contract with some Medicare providers around social care management, but it's pretty strict and narrow. And this seeks to expand that, maybe create some new codes, that kind of thing. So that's one piece of it that we commented on. Yay, go for it. We want you to do that. The other piece of it that our national association commented on was talking about whether or not community-based organizations like area agencies on aging could become Medicare providers in their own right for these types of services. So typically, if you're going to have that kind of care management, it has to be under the auspices or a subcontract with a current Medicare clinical provider. And so we're trying to suggest that, yes, the clinical piece needs to be integrated, but it doesn't necessarily always have to, we're important too. So we need to have our own Medicare billing authorization. Kaiser Family Foundation also published some look at how the ending of our pandemic era flexibilities that we have all enjoyed in the home and community-based service settings, as well as the drop in funding that we're going to see because we won't have that pandemic funding going forward, how those will impact HCBS going forward. KFF also released to Shannon's talk or discussion about mental health, a look at the 988 suicide and crisis lifeline implementation 1 year after its launch. So that takes more of a national perspective. And we certainly hope that is a service that older adults are taking advantage of if they need it. So there's also a big section in here on housing. AARP came out with a kind of a big toolkit that they published on their website with their prescriptions regarding housing policy, et cetera, from multiple perspectives, which I thought was very interesting and complements the work that Division of Aging is doing in concert with IHCDA, as well as some of the work that we did as I4A on housing late last year and through earlier this year. And I'm hoping to get that out by the end of October. Also, further discussion in general from a national perspective on the housing crisis for older adults. I mentioned that there is reporting on both from a local perspective through Axios Indianapolis, as well as a national perspective of kind of this crisis we're running into and lack of financial preparedness for retirement, given the financing of that has changed for younger generations. This gives us, looking forward as a state, the opportunity to think about the need for things other states have started to implement, including state-sponsored retirement savings programs in which people who don't have access to 401ks on their job could access one the state administers. This wouldn't give a match to people unless the state voted to do that, but at least it provides a vehicle for people to save, as well as long-term care savings programs that states have implemented, which happen through partnerships with employer and payroll deductions. And finally, I think we've a couple of miscellaneous articles in there as well, but we'll just end there and see if y'all have any questions. Hopefully we won't be so busy with all this federal land stuff if we can avoid a government shutdown. Yes.
I just checked my email. I don't have.
Okay, so Julie can forward the link. We'll forward the Dropbox link to you so that.
Yeah, 'cause I don't have it. I don't, you know what, it could be that with it being so big that they couldn't process it. when
Yeah.
They have,
Mhm.
because it's not there.
Yeah, Julie let me know that there were some people who got it and some people who didn't. And so because of that, I posted the packet to Dropbox and created a link for you to access it. Okay, well, you're going to get a link and then you'll click on that link and that will take you to the packet.
Okay. Thank you.
Okay, thanks. All right, thank you, everybody.
Well, I think that's it, unless you have something, Joanne.
You know, something's bothering me this afternoon. I just feel like either I'm not understanding or we got some unfinished business. But Jim, I think you referenced twice how hard it was to get from parking to here. And I just got a little problem. Sitting here on the Commission on Aging and the Choice Board this afternoon. People are volunteering to be on these, these boards and commissions. We need to be sure people that have some mobility issues can get from where they need to park to our meetings. And I don't know where this needs to go, but I can't think of a better place to raise it but here. I mean, there's something wrong with this picture, I think.
You know what, there used to be some parking right down here where you could park if you had handicap license plate or whatever, right down here.
Right.
And that would be,
Pardon me? Can I use that?
yeah, and that would be so much closer than you walking over here and fighting to get across the street. So I'm just wondering, did you bother to look down here?
I didn't know if that was only for the legislature or.
I don't know. I've known that.
Yeah, I think it's restricted when they reconfigured Senate Avenue. Because Senate Avenue used to go through.
Yeah.
And then this plaza was created and they reconfigured Senate Avenue, which eliminated most of the parking. We used to have a representative who had a parking place right by the west entrance of the State House. I think it was before your time, Carolyn, but he had a pass that allowed him to park there and enter the accessible entrance on the west side of the State House because of his mobility issues. But there is still some space, I think, on both ends of Senate Avenue, right? But it's restricted. But couldn't FSSA work with Department of Administration or somebody to
That's what I was
figure
gonna
out?
say, is we can reach out to IDOA and see, they operate the building and the complex and see what options there are.
Well, and you can come in off of, what is this,
Robert E. Orr Plaza.
Orr Plaza
Yeah.
on this end. I mean, heck, they bring food trucks in. Surely there's a way that Jim and others could park, right?
Well, so let's chat a little bit, Jim, and we can see what we can work out, and if, we can always meet at a.
No, it's not just Jim. I mean,
Yeah, no,
I think there are probably a number of people who would benefit from having more accessible parking options. It's not for the entire day, it's for a period of time.
Yeah, there's very few handicap spots along the street.
Yeah, but
You.
I mean, I love the idea of having the option to participate virtually, but I think there's still a lot of value in being in person.
And
And
tough if I was chairing the meeting to be virtual.
yeah, but even if you're not sharing, I mean, there are benefits to being in person.
There is.
And I think it would be good to make sure that we accommodate not only Jim, but everyone. So Joanne, thank you for flagging that. Yeah, so who's gonna follow up on that?
We will follow up with IDOA.
Okay. And then you'll mail Jim his parking pass.
If I can do it, then I will. Yeah.
You can do it. I have faith in you, Leslie.
You give me a lot.
Might check to see if national space is an issue. You might check to see if we can move most of Europe, which would provide the reverse.
All right. Thank you. I think that's it. Do we need to have a motion to adjourn?
So moved.
Second? All right.
All right.
All those ready to go, say aye.
Hi.
Let's go.
I know what that makes you. Motionless.
Oh.